Hello students, we will discuss a common condition, swelling, which we come across in day-to-day surgical practice even in OP. Just see what this condition is, what this swelling is. Look at that in the toe, dorsal aspect of the toes, foot. See that what this swelling is. Very well localized swelling. This is implantation dermoid. So what are the features? It is an acquired cyst due to minor trauma. Epidermal gets buried deep into causes some sort of reaction and causes cyst formation. Common in fingers and toes, common in farmers where you go barefoot, common in tailors, common in people who use fine objects for some their professional work or technical work. Common in farmer, tailors, painless, smooth, cystic swelling, tensely cystic. It is adherent to skin, mobile, but in the subcutaneous plane, remember. Differential diagnosis lipoma, sebaceous cyst. Treatment is surgical excision under local anesthesia. Simple as is sufficient. Sometimes it may cause complication, rupture, and from a raw area. It gets adherent to the skin because the skin epidermis get buried into the deeper plane and causes a reaction from say capsule there and from the swelling which is adherent to the skin. So that is the typical. It is cystic. Pressure test may be positive, small, hold the swelling over the summit. Indent, then you get a movement. So that is the implantation dermoid. Complication, infection, rupture is the complication. So very common short note asked, oxy they will keep, short case they will keep in the exam. So dermoids, different dermoids you have to know, secretation dermoid, implantation dermoid, tubulodermoid, teratomatous dermoid. So all these things you can read in the book. But this is implantation, remember, so figure out how exactly it looks like. So you can go through for this exam with swelling, my clinical methods in surgery, current edition with the video, how to examine his patients. And my manual gives a very detailed explanation of all these conditions, everything as far as CBME syllabus is considered. My operative surgery covers a technique, small excision to the major surgeries. Tissue approach shows how to suture the tissues, it is playing properly. And my DigiNow lectures through JP gives a very clear lectures about every topic covered, including examination, specialties, instrument, X-rays, operative surgery, specimens, and so on. You can always subscribe for a year and understand surgery in detail and face the exam very confidently. So students, I hope you understood this lecture very well. Thank you very much.